I'm anxious. I have anxiety.
There's poop on the wall.
There's
the sterile
fecal
lighting.
matter all over the place.
All the big scary men.
With tattoos. They hate
Most men are afraid of needles.
Yeah. Seek help.
Seek help.
Yeah.
Call 911.
Welcome to the Captivate Standard. I'm your host, Ireland Walker. This is the podcast that's setting the bar in all things aesthetics and wellness treatments in Central New York. Let's get into it. Rylie Lang and Caitie Wojdyla, I'm so happy to have you here for the second episode of the service series and the third episode of the Captivate Standard podcast. How are you both doing today?
Amazing.
We're living.
Very excited to be here.
So lame.
No,
We're good. We're
talking about two of the most popular services here at Captivate, IV Therapy and vitamin shots.
Yeah.
So, Caitie, the name IV Wellness is in the name Captivate IV Wellness and Beauty Bar, the name of our brand, our company. That's how we really started out. We've expanded, obviously, to do way more, but it started with IV therapy and absorption.
Yeah.
Can you talk about the process over time?
Yeah. So I traveled all over the country in my previous job, and I noticed that people were getting IVs all over, like in New York City, California, and we didn't have it here. And I think there was only one place that really offered it, and I just felt like we could bring it to the next level. So I started training on it and doing education, talking to Rebecca and Christina about it, and then adding all the other therapies that we have, and it's just grown into something that I feel like appeals to everyone, and that's kind of what Captivate is.
Definitely. And I think you guys stand out because you are one of the only ones that has so many customized bags and everything like that.
Sure.
So it's really big right now for you. What about research and new evidence that's coming out constantly, just recently about the benefits for everybody? Can you talk about that a little bit, Rylie, some of the benefits?
Yeah, it's very exciting. I mean, they're always doing more research on, peptides, vitamin therapy, especially like intravenous fluids and stuff to see the benefit of like you mentioned, malnutrition, all that type of things. I think we really set ourselves apart at Captivate because, we have such a beautiful space here. We're all professionals. We're all licensed nurses who are, administering the fluids. We use sterile technique. It's very professional. We've seen people do IVs out of their cars.
Oh my gosh.
It can get a little buck wild.
Get hairy.
We're very controlled, and we're all extremely diligent in following USP 797 guidelines and making sure that our bags are customized to each person.
All of our vitamins come from a 403B pharmacy.
Yeah.
That means they're FDA regulated.
Okay.
So, all of our vitamins and stuff are top quality. We really take, pride in the stuff that we purchase for our patients, and the materials, everything has to be, top tier.
Yeah.
And then the space, the beautiful IV lounge and the different rooms you have. Can you talk about what inspired that space? It's so aesthetic and beautiful and calming, relaxing.
I think that goes back to my brother's vision of the space as well. He always had this beautiful IV lounge in all of his storyboards. And it was kind of like he created a space in both here and in Skinny Atlas that is inviting for the client, be able to sit and relax, but feel a little bit bougie, because spending a lot of money on an IV needs to be a bougie experience, which is why we have the coffee bar. We have
juice bar,
all the things. Yeah.
So can you talk about the cost breakdown, since you just mentioned that? I do want to talk about how pricey they can get for people that may not know what goes into it.
Yeah, Rylie.
I think everyone should understand the benefit of IV therapy compared to vitamins. So actually, if you, let's say you take an oral vitamin every day, you're only absorbing 30 to 40% of that oral vitamin. Compared to intravenous fluids or IV therapy, you actually absorb 100% of the vitamins in that bag.
Wow.
So, all the vitamin C, all the B complex vitamins that we add to the bag, you're absorbing all of those vitamins. So that's the huge difference between vitamins and IV therapy, is that you're actually getting all of those nutrients in one shot, essentially.
Yeah, because you avoid the first pass. So a lot of vitamins, when you take it PO or by mouth, it has to go through the digestive system, and a lot of it is taken away, and you're not absorbing it fully, like you said. So it's really next level. And it's funny to see in Syracuse, it took a little while. We've been open for 3 years for people to really see the benefits. But if you go to California, people have been doing it for 10 years
and
now.
That's something that people say all the time. When they come in, they're like, oh my gosh, I didn't know that there was a place like this in Syracuse. And I'm like, well, we really, you go to LA, these are on every corner. Essentially.
Yeah,
Like,
yeah.
you know, vitamin therapy and IV
Like mini
therapy
marts
is
in
very
LA.
popular, like in,
Yeah.
you know, on the West Coast and all of that. So it's
Yeah.
kind of like we brought a little piece of it here to Syracuse.
Yeah, to
Yeah.
Captivate. So can you walk me through how an IV therapy setup works? It's basically just getting fluids, getting the IV in your arm, you're laying down. People might think of it as like a hospital. Can you clear that up for some
Yeah,
people?
you can, I mean, you can compare it to a hospital. I mean, obviously it's a way better, more comfortable vibe. You know,
Mhm.
we want you to be comfortable. We want you to be relaxed. You know, you not have to have that stress of being in the
Waiting in
hospital,
an
that
emergency room.
anxiety,
My
you
gosh.
know,
Puking
constantly
next to you.
waiting, yep, being sick, exposed to COVID, all these things.
Yeah.
No, it's a completely different vibe here. Like we have a private room, you know, there's a TV in there. We have a massage chair. Like it's supposed to be a very luxury experience for people.
Yes.
Yes.
Okay. Got it. So is there anything people need to do to prep for an IV? Do they need to get a ton of sleep the night before, drink a ton of water, have a protein-filled breakfast, anything like that? Or can they just walk in?
Well, anybody can walk in. If we can't help you if you don't have good, vein access. It's really important to have good veins.
Okay.
Not everybody can do it, but most people can. And
Okay.
I don't think there's anyone really we haven't been able
Yeah,
to
no, I
get it.
don't think we've had any problems. I mean, like I said before, we're all professionals.
Yeah,
We've had extensive training in IV.
You don't want to get poked 17 times before
Yeah.
you get your IV. So we have the best staff here ever who can put in the IVs quick and painless. That's what's really great about it. And like you said before, you just have to, drink some water. There's nothing really. We have people from all walks of life.
Yeah.
We have athletes come in for IVs for post recovery. We have people who come in who are hungover, which is like,
Yeah.
you'd think that would be a big percentage of our patient population, but it's really not. A lot of our patients are about preventative wellness. So
Yep.
we have people who come in who are, have a lot of brain fog, so they'll come in for
Yeah.
NAD. We have people who come in who are sick. The immunity IV becomes super popular from now until after the holidays.
Yeah.
There's energy IVs. There's so many different things, and we have something for everyone.
So you just got into some of the bags a little bit. Can you talk about the different combinations you have and then what goes into each? I know it's super specific, but for people listening that something might resonate with them where they want to come in and it checks one of their boxes.
I think that's the exciting thing, that there's literally something for everybody here. It's
Yeah.
all age groups that could benefit from IV therapy. It's essentially the most beneficial form of hydration. So you're coming in, you're getting the fluids. If you're an athlete, it could enhance your recovery time. If you're a student and you're working late hours and everything and you need energy, that could be improved upon. There's so many things that could be improved upon.
Yeah.
It just kind of like come in for a consult and let's talk about it.
Okay.
Yeah.
So what are the big vitamins that are going into the bags? B12, vitamin C.
They're all different types. So every IV is really specific, and it's based on USP 797 guidelines, what can be in that bag. So
Okay.
it sounds like we're just throwing stuff in a bag, but really we have to make sure the osmolarity is correct. We have to make sure the vitamins work together. We have to make sure if we're in lactated ringers or sodium chloride, which vitamins can be with what. So there's so many different. So you're getting a lot of vitamin C in the bags. B complex seems to be the foundation for most of our IVs. Just a little bit of B complex is good for everyone. It includes B1, B2, B3, B5, and B6. There's biotin in our beauty bag, a lot of vitamin C in our beauty bag as well, because vitamin C is really good for collagen. That's why it's called the beauty bag. Hangover bag has a lot of little treats for it. You get the B vitamins,
You do.
you get B12, you get Toradol, you get Zofran. Because people are hungover, they're nauseous,
They don't
and
feel
they
good.
have a headache.
The amount of I feel like we really need to start like advertising and stuff for the college population, because I feel like it's just a lack of knowledge on that.
Yeah.
Because every time I talk to somebody, like, oh my gosh, I'm so hungover, like, what do I do? Like, do I need to go get like piece of greasy pizza and water? No, actually, like, come in for an IV, have some Zofran and Toradol, and you're going to walk out of here feeling like you'd never even drank the night before.
Yeah.
Yeah.
It's really nice having SU up the street, because the parents they're all from the city. A lot of people know about IVs, and they have for a long time. I had someone call this morning actually who has it's parents weekend at SU this weekend.
Yeah.
And they have a child who's been sick for the last 2 weeks, and they know about IVs. And she's like, can we come in this weekend? So I booked one of them for this weekend, and her mom's coming with her. But we definitely can provide stuff for everybody. So it's really nice having them up the street.
Yeah. So you were talking about B vitamins and taurine. if that's how you say it.
Yeah.
Can you talk to me about the benefits of that? So when those are going into the bags, that sounds great, right? I need B12, I need all these other vitamins, but what do they do?
So taurine is actually an amino acid. So taurine can provide energy to patients. It can help with brain fog as well. There's so many different benefits to taurine. It helps with cognition and so many different things. It's an amino acid that is very underrated, and it's in our energy bag specifically, but you can add it on to other bags as well. Yep. Same with like B12. Did you know that B12, you don't make your own B12? You get B12 from meat and dairy products. So everything you eat is how you get B12. So if people are deficient in B12, you can maybe attribute it to someone who's vegan and they're not getting enough red meat, or they don't eat eggs, or that kind of thing. Or people who don't have enough glutathione. So people who don't eat any sulfa, broccoli, things like that. Okay. So and vitamin D, you live in Syracuse.
You need vitamin D.
Yeah.
You don't have any vitamin D in Syracuse because there's clouds in the sky about.
It's funny when people come in like, do I need vitamin D? And I'm like, where do you live?
You
live
do.
Here? Probably.
Yeah. So if you're vitamin D deficient, you're gonna see yourself, it makes you depressed, it makes you tired, it makes you feel all the ways that not having enough sunlight does make you feel, and we can replete that even with and it's just a simple vitamin shot. Vitamin D is oil-based, so you can't put it in an IV. So
This episode is sponsored by Captivate Cold, our juice, wellness shot, and protein shake line available exclusively at Captivate Wellness and Skinny Atlas. Captivate Cold is sourced from Pressed and made with nutrient-rich, real plant-based ingredients, never any added sugar or preservatives. Try favorites, like our non-dairy almond milk vanilla protein drink with dates and sea salt, or a rich chocolate protein shake packed with over 30 grams of protein. Also, don't forget to grab a daily citrus, root, or green juice. Thanks to Captivate Cold for sponsoring this episode. So how often should someone get an IV? Are they coming a weekly, bi-weekly, monthly? Can someone do more than one a day?
It depends on the person.
Yeah, for sure.
For sure. Okay. We've done IVs on people. We've given them, 1.5 bags because they're so depleted. Or, if they're so dehydrated, say we just give them lactated ringers with no vitamins in it because they just are looking for the fluids.
Yeah.
So like I said before, so customizable. We encourage people to come in and tell us about what problems you're having. Tell me about, what is causing you concern. And then we can kind of make a customized plan and go from there.
Okay.
Yeah. And everybody needs a medical history first. So it's really important to make sure that there are no contraindications. We're not giving someone too much fluid if they already have heart problems or fluid overload or high blood pressure. And everything is still regulated by our medical director, Rebecca, who you met in the first episode and who you know very well.
Yes.
But everything is customized to the person.
Okay. So there's no allergic reactions or anything happening.
Making sure,
Yep.
You do that background.
We go over allergies and everything with the patients. Any possible interactions are gone over with the patient, as well as an extensive medical history and background.
What's the most popular request you get for either a bag that someone has seen on our website, like the Myers cocktail or the immunity bag? Or is there a reason why people are coming in that's
like their
popular?
biggest concern that they would come in for? I think energy. Everyone's always like, I'm so low energy.
It depends on the season, really.
Yeah.
Like Myers cocktail is actually really good for allergies too.
Yeah.
So
there's somebody actually running currently upstairs that comes in for Myers cocktails every 3 weeks.
Yeah, and he has cyclic vomiting syndrome, and they really help him with that.
Insane results with the Myers cocktails and the B12.
Yeah, we have a lot of different stuff, and I think immunity IV is going to be extreme. We already know it will be really popular once the kids are in school now.
Yeah.
The younger kids just started school like the past couple of weeks.
Flu season.
Everybody gets sick. Flu season comes. Everyone's going to get COVID again, and then people are going to feel run down, and they can come in and they see a difference. And not only can they come in for an IV now, but they can also hang out in the infrared sauna for a detox too. So there's lots of different things.
It's actually funny. My friend Abby, shout out Abby, texted me last night. We have a wedding this weekend, and she's like, "Oh my gosh, like I'm starting to feel sick. Like I have to go to the store and get vitamin C packets, whatever." And I'm like, "Just come here.
Yeah,
get an immunity IV. Like come here.
Yeah, you feel better in the end.
Get fluids, get actual vitamins instead of
so you can make it through the wedding.
Yeah.
Right.
And an IV can take anywhere from 15 minutes to 2 hours, depending on which one you get. Is that right?
I would say not 15 minutes.
I would love to say 15 minutes, but no, probably a vitamin shot takes 15 minutes only because we have you come in and the whole process consent.
Got it.
But an IV can range anywhere from like 45 minutes to 2 hours, 2 hours for NAD. We run that super slow, and we'll get into that more, but yeah, it's just different for every IV. But that's a good question to ask prior to booking, and all of our bookings it'll pick the IV based on the time, and you'll know how long
it's also very patient dependent too. Like, say you don't tolerate, fluids very well, and we have to run you kind of slow, and, you feel a little funny with glutathione, or you feel a little funny with B12, let's run you slow. Let's talk about it. Let's see how you feel.
Everybody's different.
And you're monitoring everyone that's having an IV. You're not just like leaving them if they're feeling nervous.
Yeah,
it's their first time.
And they have call bells too if they want the privacy and they've been here before, or we put people in the IV lounge if we like to keep our close eye on them. But yeah, and we check in constantly. So I think that, and people just get to know us and they come back a lot.
Yeah.
It's very personal.
Yeah.
People like coming in and chatting and
hanging
feeling
out.
replenished.
What would you say to somebody who doesn't believe in IV therapy? Obviously, you know the benefits because you see it every day, multiple times a day. But for someone who doesn't believe it, just given the fact that it is so quick, that there is multivitamins, there's other things that people can take to get what they need. What would you say to someone that's not buying it?
Haters.
I would say,
The haters.
what's not to believe? What's not to believe? It's a science. So, like I said before, you're absorbing 100% of the vitamins. So, you can still take your multivitamin every day, but you're not going to see a big benefit as if you were doing intravenous fluids like IV therapy.
Yeah.
Okay.
Yeah. And we get people who always talk trash on the Facebook or Instagram about I'm not going to pay that much money for a vitamin when I can just go get a supplement. And people are entitled to think that. It's just the facts and the science prove it otherwise. Yeah. And we really see the benefits. And I invite anybody to just try it because they'll see the benefits afterwards.
Mm-hmm.
So are the benefits instant? So after you finish your bag, are you feeling like, whoa, I'm ready? Or
the general consensus is everyone feels relaxed after.
Yeah.
Okay.
Like they feel like, they're ready to go home and kind of take a nap.
Yeah.
Relax. It's more or less like, I think the atmosphere here, you're just very calm. I always tell my patients that you're going to see the full benefit probably the next day. Like you're going to feel like, let's say you got B12 today and, you wake up tomorrow morning, you're going to notice a more gradual energy boost. It's not going to be like you took a Red Bull and you're like, whoo, like I'm ready to go.
Yeah.
It's going to be a more gradual, natural energy boost. So that's really the big difference.
Yeah.
Yeah. And with an energy drink or taking something that's quick, I feel like there's a crash.
Oh, yeah.
For sure.
You have a peak and then you come back down.
And then you feel worse than you did before.
And then you need another energy drink.
Yeah.
And then you need
and
a
it
coffee.
Creates an addiction.
Yeah.
But yeah.
So how long are these benefits lasting?
I think that is, again, another patient dependent thing. It's like, how long does an IV take to go through your body? Probably a day or two, but how you're feeling on the inside is what matters. And when people want to come back, when they feel like, you know what, I kind of want to come back next week, like our Myers cocktail guy, I feel like I'm feeling a little nauseous or whatever. Yep. People come in independently. People buy packages, people get memberships. But we don't really force anyone to feel like they have to come back. Yeah. But people do come back.
I want to talk about people who may be scared of needles. Is that a deterrent?
All the men.
With tattoos.
Oh my gosh. All the big scary men.
With tattoos. They hate
Most men are afraid of needles.
Okay.
No hate on the men, but it's just true.
So what do
I'd
they
be concerned
do?
if you liked needles, truthfully. Like, that's what I tell my patients, like, oh, I don't like needles. I'm like, well, if you said you did, I'd be concerned.
Yeah, maybe we'd have another chat.
We'd have a separate conversation.
There's another issue.
No, but so like I said before, we are all professionals. Like, Caitie's had years and years of experience with IV therapy. So have I. So we're professionals. Like,
you're in good hands.
There's been people writing reviews on, Rylie's been pulled my veins out of hiding. Caitie was able to.
Oh my gosh.
Yeah, there's like, people really, if they give us that initial trust and they're like, oh my gosh, like you actually are really good. Like that didn't hurt at all. Like, give us a little trust and we're going to be able to help you.
Okay. But it's pretty painless for the most part. You can look away and then you're just
look
relaxed.
Away. If you don't like the look of it, if you don't like, seeing something out of your arm, I'll cover it up.
A lot of people don't like to look, and I can tell because they'll like tense up, and I'm like, just look away, you're gonna be fine.
Just relax.
But it really is super easy once you get the IV in. A lot of people don't know this, but the needle doesn't stay in the IV. It's just the catheter, just a piece of plastic that stays in there the whole time, and that makes people feel a lot better.
Yeah. And I feel like some people maybe have seen horror stories of like something happening, or
patients have their own horror stories, really. I mean,
Yeah,
Yeah.
we've
I
never
think
had any problems.
We've never
Yeah,
had
it's
any
not
problems.
here.
I think
Yeah.
people are like, they come in and they're, oh my gosh, I remember when I went to the hospital and they had to poke me 17 times and there was
Bruises
blood
all
running
over.
down my arms. They got it in my thigh, and we're like, listen, let
Not
me take a
here.
look.
Yeah.
Let me see if I can get it. I'm not going to poke unless I feel confident.
Yeah.
Let me look. And half the time, actually more than half the time, we're successful.
Yeah.
A lot of the
And
times.
a lot, you know, what's funny, that reminds me, a lot of the patients can be pregnant patients who actually come in, who go to the ED when they're pregnant because they're super nauseous and they need fluids. And they bypass that whole system by coming to us. And they are so grateful.
Yep.
And we see a lot of moms. So,
Yeah.
and it's all very safe. And we make sure it's approved by their OB/GYN. But it's really nice for them to be able to get in and get fluids.
Not to say
Yeah.
that if you are having a medical emergency that you should come to Captivate,
No.
because you know you can get
Please
in
don't.
faster. Please do not.
Yeah. Go to the hospital.
Please do not.
Do not.
Yeah.
If you need vitals done or
If you're having chest pain, do not come here for fluids.
do not come here.
Seek help.
Seek help.
Yeah.
Call 911.
So let's talk about side effects. So someone goes home and maybe it's after the first time and they're worried, maybe they're feeling a little bit weird or out of it.
Yeah.
Not that would happen, but sometimes you feel
Yep.
odd after something new. Talk about side effects that are maybe attributed to maybe someone that was doing it for the first time.
It's funny. I think we like to call them more or less sensitivities
Yeah,
to the medication.
okay.
Yeah.
So I actually had a patient that was in the other office that, I gave her, I forget what IV we did for her. I think it was an immunity IV. So that comes with, a large quantity of vitamin C, B complex vitamins, and then you get a push of B12 and a push of glutathione. So this patient has never had glutathione before. So one of the questions that we typically ask is, do you have a sulfate allergy? Because there's an interaction between the two. So she did not have an allergy. So I gave her the IV. She tolerated it perfectly fine over an hour. And then it was probably like 45 minutes after she left, she had called me back. And I went to the phone and I was like, is everything okay? And she's like, I just feel a little funny, like almost like, they can't really describe the feeling.
Yeah.
Sometimes it almost feels like, you're in a different reality, like, you're disassociating.
Yeah.
Kind of.
Yeah.
Like and then people get anxiety and it makes it 10 times worse.
They get worried.
So I'm like, relax, like, take a sip of water, lay down for a few minutes and then call me back. So she ended up calling me back and she's like, I still feel funny. So obviously me being a nurse, I call the medical director and I'm like, hey, listen, like, this is what's going on with this patient. She might be having a little sensitivity to glutathione is what it sounds like. And, Rebecca is amazing. Rebecca is very professional. She's very smart. So, I believe we both ended up reaching out to the patient again, and just letting her know that, she probably had a glutathione sensitivity and, she's not going to have a reaction. She's not going to, her throat's not going to close, anything like that. More or less, we would probably run the glutathione very slow next time if she had it. People are sensitive.
Yeah.
Everybody tolerates medications and vitamins differently.
Yeah.
So, in that person's case, I called her the next morning. I reached out. We're constantly following up with our patients to make sure that they are feeling okay and that they have the support that they need.
And she was absolutely fine.
She was absolutely fine.
Yeah.
Yes. Yeah. So the next morning she was like, oh my gosh, like I feel amazing. Like I feel way more hydrated. I was like, do you still feel like you're, like,
Spacey
she almost
or-
spacey, like
Yeah.
she described it as dizzy. But I'm like, do you still feel spacey? And she's like, not at all. So it really does pass. And, we are going to be here for you and help you.
Yeah.
Yeah.
We're not just
again,
going to leave you hanging.
By looking at their allergies and everything, their background, no one's going to overdose or anything like that on vitamins or have too much of something.
No, and that goes again to what can be in the bag legally through USP 797 guidelines, osmolarity. Everything is calculated so that it's safe.
So what else sets Captivate apart in the IV therapy realm from other places? Obviously, the amount of bags that we have. Do you want to talk about NAD a little bit? Maybe the beauty bag has collagen for hair, skin, nails. That's maybe unique.
I think what's unique to us is nothing is pre-made. There's no like mix of bags we buy ahead of time, which I think is a lot of people around here do. They're not getting as many vitamins in other places as well. We use preservative-free vitamins, which is huge. A lot of people are really knowledgeable about vitamins and ask for preservative-free, so we have that. It helps with like side effects as far as, and nobody likes preservatives, but we're very good about that. What else makes us special? I don't know. I think that
the space for sure.
The
such
experience.
Experience is half
The
of it right
lounge.
there. Like, I mean, think about if like there's no joy in getting an IV at the hospital at all.
Yeah.
I'm anxious. I have anxiety.
There's poop on the wall.
There's
the sterile
fecal
lighting
matter all over the
Yeah.
place. The nurses are also in a huge rush because granted, it's the ER, it's the hospital. They're running around. Maybe
no one really wants to be there.
Maybe they miss your IV 10 times and they're like, well, sorry, blah, blah, blah.
Come back later.
Yeah.
It's different here.
It's a bougie experience. It's nice. People love it. And, we can talk to about people what they want to do in the future. And maybe they're here for a hangover IV, but they really need a NAD IV. Maybe they need to have some brain fog. Maybe they want to help with like anti-aging or addiction.
You wouldn't imagine the amount of people that come in for something like, let's say, I need Zofran because I'm hungover. And then it's like, we start talking and it's like, well, actually, it sounds like you would really benefit from NAD therapy.
Yeah.
Or it actually sounds like, ketamine might be a really good choice for you. So it's kind of like, everyone coming in is kind of like, going to the side for different things too, because they realize that we have so much to offer.
Yeah. I want to talk about your personal experiences with IV therapy. How many IVs have you gotten from Captivate?
Thousands.
I know. It's more of like the hundreds. I wish I could do more IVs. I'm supposed to do them like once a week, but I don't. I know for a fact that they work just because I have so much energy afterwards, and everyone's chronically dehydrated. That's another statistic people don't talk about enough. Like 70% of the population, even more, is chronically dehydrated. So just a bag of fluids will help you, much less the vitamins that are in the bag too. Yeah. So it helps with cognition. I've had a lot of brain fog lately, and when I get an IV, I feel so much better. My husband has Lyme disease, and he yells at me because I don't bring in enough IVs to him, but he loves to have an IV, and I wish I took better care of him. He likes the glutathione. He works out a ton. So it all helps with detoxing your system and preventing inflammation. Inflammation is like the source of aging. And so by getting an IV with lots of vitamin C in it, you're preventing inflammation. So I love a good IV. It's half the reason why.
Yeah.
What's your favorite, Rylie, that you've
I think my favorite probably be like the Myers cocktail. I feel like it just has a little bit of everything in it. It has, magnesium, calcium, vitamin C, B complex vitamins, and then you get a push of B12. So it's kind of like a little all-in-one.
Yeah. Yeah. It's like the foundational IV. That was one of the first ones ever started by Dr. Myers. Yeah.
If you could make your custom bag, what would it be?
It would be the highest dose NAD. 50,000 milligrams.
50,000 milligrams. No, I do really love NAD. I wish I had more time for it. It does take me a little extra time. But NAD is good for everyone. Well, almost everyone, but it really helps a lot with the anti-aging process and your brain working properly. So I love a good NAD IV.
People don't even know what NAD is. Can we talk about that for a second?
I know.
Like, people are always like, well, what's that? NAD, what does it stand for?
Nicotinamide dinucleotide.
Dinucleotide. So fun to say. So
let's stick with NAD.
NAD is found in your body naturally. So after the age of 23, 24, or even 26, it depends on the person, it starts to deplete. So NAD is essential for, your brain fog, your skin elasticity, mental clarity. What else?
So NAD, actually, if you think of 8th grade science, this is how I always tell our patients. In 8th grade, what's the powerhouse of the cell?
Mitochondria.
Okay. So what feeds the mitochondria energy? NAD.
Yeah, don't look at me for that. NAD, okay.
So I like the way you explained it.
Yeah, I think that it's important to remember that big powerhouse is given energy by NAD. And so as you get older, your NAD drops every 20 years, 50%. So you need to replete that NAD in order to help your body feel its best, help with your brain, help with your skin, help with,
cell metabolism.
Yeah. There's so many different benefits of NAD. And if you just think about it from an aging perspective, as it goes down, what happens when you age, right? You want to help slow that down.
Right.
So,
I mean, there's a reason why everyone in LA and Hollywood right now are getting infusions of it. I mean, this is like, NAD is going to become the next greatest thing. I feel like it's just it's coming.
Yeah.
It's coming.
It's here.
It's here.
So can you talk about any unusual requests that you've had, maybe? Anything someone has come in with a strange side effect or symptom and you're like stumped? Or is there anything like...
Well, that's every day.
That's every day. It's hard. There's a lot of odd questions. I think what's really good is people are really starting to read more about what's going on.
People are doing their own research now. So that's very exciting, you know.
Or they're just going on ChatGPT.
Yeah.
I mean,
who isn't? Yeah.
No, they're doing their own research, and that's really good. Like, you know, they're researching, you know, why am I low energy? And then they start reading about NAD, and they come in and they want to ask questions, and they want to, you know, learn more about it from a professional instead of just going online, going on TikTok and being like NAD therapy or peptide therapy. And then, you know, you're listening to all these people that probably aren't even medical professionals and getting advice from them.
And you're in the rabbit hole.
Yep. Yeah. Exactly.
I mean, if you have a question, we'll have an answer for you. And if I don't have the answer, Rylie doesn't have it, Rebecca will.
Yeah, somebody here will have it.
So we'll figure it out.
To wrap up the IV portion, I want to do IV or not to IV. Some of these are silly, but these are symptoms that someone could be facing. And if they come in with these and they're like, I have this, do they need to get an IV? And this could be just any IV that you think might fit this.
Okay.
But what if someone comes in with a fever? They have a high fever. Would you send them to the ER, or can you cure that with a
That's
IV?
a good question. First, we're going to see how high the fever is, how long they've had it.
We're going to take vitals.
We're going to do vitals. And then if they got the flu, get the heck out of here.
Yeah.
First of all, get a mask on. First of all, you walk in, you're getting a mask on.
Yeah. Double mask.
Yeah.
We're masking because not only are we protecting ourselves, but we're protecting other patients at Captivate. So you know, we're going to make you put a mask on. Truthfully, we would take your vitals, and, you know, if your vitals are within normal limits of what we would say, then, you know, we'll administer the fluids and everything, and obviously give our medical director a heads up for sure.
And then we'll follow up with them. Yeah.
Yep.
Okay.
Yep. And then, you know, probably do post vitals as well to see how they did after the fluids. But yeah.
It just depends how healthy they are. Like if they're younger, if they're older, there's so many different factors that go into it.
But what we would recommend would be an immunity IV.
Yeah.
Okay. Got it.
For vitamin C.
What about food poisoning?
Yes. 100%.
All the time.
Okay. So they would do what bag? What combination?
Probably. So this is funny. The hangover bag is not just for being hungover, but it's also for like food poisoning. We can do just a dehydration bag with some Zofran. They may not need the Toradol, but we just make the bag specific to that person. 100%. We see it all the time.
A lot.
What about dizziness after if someone did a really hard workout or just had a long run and they're kind of feeling like dehydrated and like out of it, really dizzy? Would that be a good time to come in?
Zofran almost has a grounding effect to it. It makes you feel like more grounded and, you know, in the space of, you know, relax.
In the moment.
And after like a big run or like a, you know, a football game or something, your lactic acid builds up, and a lot of people can have those side effects. So we're going to want to replete those amino acids. And that's why we do like the recovery bag and add some vitamin C and all those things. Yeah.
What about high blood pressure or super low blood pressure?
No. Go to the emergency room.
Okay.
Super high blood pressure.
We can't help you.
Yeah. No, we don't give anyone with high blood pressure, non-controlled high blood pressure. Don't get me wrong. If it's controlled or taking their medicine, okay, we can give them an IV. But if they have like uncontrolled high blood pressure, no, we wouldn't treat them. And if they have uncontrolled low blood pressure, it's not safe. They probably need to go to the emergency room. We actually turned someone away one day I took their vitals in the room, and I was like, you need to go to the hospital. There's something else going on here. So, we're pretty safe here.
So what if someone is at a really old age and they're on medication or whatever their case may be? Is an IV good for someone who is in their 80s or 90s?
This is a good question.
So good.
Yeah. First of all, we make sure the person, what kind of healthy range are they in, right? This isn't end of life care. So if someone is like, you know, not really not like on their deathbed and no one is treating them, absolutely not. We're not going to make anything worse with fluid overload. But if someone is, you know, in their 80s and they're still super healthy and they're not taking too much medication, we'll absolutely treat them because they're chronically dehydrated as well.
I was going to say our older population seems to be very dehydrated. They don't drink a lot of water. They don't necessarily have the best diets either. So, you know, vitamin supplementation can be crucial for them. Like they can feel amazing, you know, with energy and just feeling like themselves again sometimes.
I want to go into another game, kind of a quick this or that. So, Rylie, would you rather have an energy boost or immune support? That might overlap, but
probably in the current moment, immune support for sure. Because flu season's right around the corner.
Yeah,
if
the
not
holidays.
already here, everyone's coming in sick, to be honest, for immunity IVs. I'm just trying to boost my personal immunity.
Yeah. Would you rather do a solo session or would you rather do it with a friend, Caitie?
I like to do it with friends. I don't know. I like to talk to people. I don't like to be by myself.
Yeah.
Just
When,
like in
when
the
I do
corner.
an IV in my office, I love when people come in. I don't know.
Yeah.
I like to do it with other people.
Rylie, first thing in the morning or after your day is over when you're winding down?
Oh, good question. I don't think I've ever done an IV, and I'm going to try that.
Oh,
I'm going to
at
try that,
night?
Ireland.
I've done it at night.
I mean, I think I've done it like after hours, probably like at night, but I don't think I've ever come in and did it in the morning.
Yeah.
Maybe we'll try that.
Yeah. It's good to get your day
Fresh
started
IV
with an
in
IV.
the morning. It's
Yeah,
probably
crisp.
lovely.
Yeah.
Crisp.
On your day off.
On your day off. Yeah, I'm going to try that.
Caitie, would you rather have vitamin C, like a lot of that going on, or a lot of vitamin B and B12?
I love vitamin C. I mean, that's a tough question. I like B12 for energy. I can't have too much B12 because my B12 is too high.
She doesn't synthesize.
I don't synthesize it. No, but I think vitamin C is good for everybody. So
Before we move to vitamin shots, I want to just get some final thoughts in here. If someone is curious but super hesitant, what would you say to them? Or if someone's nervous, or if someone has done an IV before and they say, I don't feel any difference.
yeah.
Give us a chance.
Yeah.
Come in and talk with us. Like I said before, we are quite a different experience than you've probably ever had before.
Yeah.
We're luxury, we're professionals. We want to see you have, your best feeling self. So just come in, talk with us. If we're not comfortable with treating you, or we're not comfortable with the options that you've given us, then we're going to tell you. We're going to be like, listen, I don't think this is going to work for you. We are very honest. We're, like I said.
Yeah. There's no pressure as far as how someone's feeling. And if you don't feel like coming in, we can come to you.
With the mobile ambulance.
Yeah, there you go. We'll whip the ambulance to your house.
Yeah.
Yes.
Rylie loves the Ambo.
Yeah, it's so fun.
It's fun, but it's big.
It is pretty big.
It's large.
But it fits a lot of stuff in it. So
It's like our little mobile IV.
Captivate.
yeah.
Okay. So let's talk about vitamin shots. You probably, and everyone's seen them popping up, med spas, wellness centers, and celebrity routines.
Yeah.
People are getting them just quickly in the morning or wherever time of day. What are they, Caitie? And why are they different from traditional supplements or taking like an IV or a multivitamin?
So they're just quicker. It's actually, it's similar to an IV where 100% of it is absorbed because it's put right directly into the bloodstream, mostly intramuscular. But versus taking a pill or something like that, you're actually getting 100% absorption, and you can do it really quick too. So we do have patients who are on the longevity program who take NAD subcutaneously at home. So they get their own vial. They have a very customized program, and they can sometimes do glutathione IM injections at home too. But it's a quick and easy way to be able to supplement your vitamins.
So it's another
They
needle.
do a shot intramuscular. Sometimes it's in the butt, depending on how much they're getting.
Sometimes they're spicy, so we like to do them in the butt.
Dip them in the butt.
Burn. There's a little spice.
Yep.
But they're not drinkable. When people think of vitamin shots, they might think of like a little turmeric shot or something like a wellness
Like
shot.
our pressed wellness shots.
Yeah.
Yeah, no. Vitamin shots are quick. They're in the room. They don't take it orally. We take it intramuscularly or subcutaneously.
We do have liposomal vitamins that we have as well. So Symbiotica. Love Symbiotica. It's an amazing brand. But it's actually like a squeezable packet you squeeze in your mouth.
Like
so
a little gel?
Glutathione, vitamin C, creatine, a couple others. So you just literally squeeze it in your mouth and you
Elderberry.
absorb it liposome.
Yeah.
Through liposomal.
Huh. Okay.
Yeah, it's interesting.
When I see a vitamin shot situation happening, I see two big vials, I guess you could call it. It's probably not the right term, but there's some is red. Some of them are like yellow.
Yep.
Talk about what goes into a vitamin shot.
So like I said before, all of our medications come from a 403B pharmacy. So the red that you're seeing is methylcobalamin, cyanocobalamin, or what's the other one? Hydroxycobalamin. Those are all of the forms of B12 that we have. So that's that red that you see. It's good to actually see that red. That means you're actually getting a form of B12.
And it's not a dye. We've gotten that question before.
Not a dye. Not at all. Like we've actually, you were there that day and somebody asked, like, is this red 40?
Oh my gosh.
I myself was like,
Good question.
I'm like, wait, why is it? But and then I looked at it. It's actually like the natural coloration of like the B12s, like cyanocobalamin or whichever one it is. That's the natural coloring. Okay. So that's what you're seeing. It might look scary, like it looks like blood or something.
Yeah.
And then there's like a neon yellow. That's that B complex vitamin.
Okay.
So not scary at all. Natural coloring. It's not dyes. It's just the natural color of the vitamin.
And you said these are quicker, so about 15 to 20 minutes.
No, I mean you put a vitamin shot in less than a minute.
Okay. Okay.
We do it slower for NAD because it's cold and we don't want the side effects. So we do it real slow. Same with Toradol. Toradol hurts. So you want to do that slow as well. But yeah, it's quick. It's less than 5 minutes. It's just about the experience of waiting, hanging out in the lobby.
Doing medical, that really takes more.
The medical health history takes the longest part of it all.
And then how long are the side effects or that boost that you're feeling from getting the vitamins? How long does that last?
It depends on the person and how they're feeling and their absorption. Everybody's different. But it can last a couple weeks if people feel like vitamin D. We don't recommend more than every couple weeks. And then we retest your labs too. So that's actually an important part too. We're not going to just treat people willy-nilly. Yeah. We do like a lab workup on people.
A lot of people don't even know we have that. Yeah. A lot of people are like, oh, well, am I supposed to, just bring my primary care labs and like check my vitamin D level? We can actually do that here. Rebecca can send scripts so we can, check your vitamin D level, then do a series of vitamin D and then check your levels after to make sure that they've, evened out and they're within normal limits now. So it's actually very exciting and cool for patients to actually see that change and have the lab work, that's available here.
With vitamin shots, is there a custom dose for people or is it just one constant dose that everyone gets?
So it just depends on what vitamin it is. And we have several protocols to follow. Glutathione is different, what they want to do, how much they're getting, what their goals are. Everything is really different for each person.
Is a good time to get it before a big week or after traveling or some important event coming up? Are those things, even like the wedding you were talking about?
Absolutely.
Something like that is good.
Yeah.
Like before you travel, before a big event, you want to feel your best at these places, obviously. So you want to do all the supplementation before. You're going on a trip and afterwards, really. You're going on a trip, come in and get an IV before your flight to prevent what's it called? Brain fog? No, not brain fog.
Jet lag.
Jet lag.
Yes.
Yeah. There's indications for vitamin therapy and vitamin shots prior to traveling, post travel. And so many different variables.
But to be clear, vitamin shots and IV therapy aren't a replacement for a healthy diet, anything like that.
Nothing. Everything works in conjunction with a healthy diet. You can't expect, like, for example, semaglutide. If someone comes in here for like a weight loss medication, GLP-1, and they don't want to exercise and they don't want to eat healthy, they're not going to get the best benefit from it. Same goes with vitamins too. You want to really help your body work with the vitamin.
And then Rylie, who's the most popular client that you see for vitamin shots? Is it someone who does travel a lot, like we were talking about, or is it just
vitamin shots? I see quite a few people that come in for just like weekly shots or bi-weekly shots. Typically, it's most popular like B12 or NAD plus. I actually do have a patient that comes in for, we call it her normal 3. It's B12, B complex, and
ALA.
Yeah. You know who it is. She's a lovely patient, but she really does see quite a benefit from those 3 injections because she has underlying health disorders and stuff that she needs supplementation. So like I said, she sees amazing results.
And do some of the vitamin shots work in conjunction with other programs that we have here at Captivate?
Absolutely.
Yeah, for sure.
Okay.
And you can do IV therapy with just about everything here. You can get a facial and get an IV during it. We did that yesterday. Someone who was getting a dermaplaning and a hydrofacial, and she's like, I'm going on a trip tomorrow. What would help me? Would IV help me? And we were like, well, yeah, it would help you. So we did immunity IV while she was getting her facial, and she got both done in one shot.
Anything else you guys want to add about IV therapy or vitamin shots?
I think we said it in our first episode is, IV is for anybody and any client can try it. And we always make the bags custom to what you actually feel like you need. So just, even if you're nervous, but you want to start somewhere, an IV is where to start.
Well, thank you both so much for joining me on this episode. I think we'll see you in the future, hopefully on another episode, but we were so happy to have you.
Thank you.
Bye, guys.
Bye, Ireland.